Our group will focus on the Ebola virus, a zoonotic disease that affects the Democratic Republic of Congo. The 10th outbreak happened last year, killing over 200 and infected over 3,000. Fruit bats continue to be seen as the main reservoir for the Ebola virus. The virus spreads through direct contact with the animal carrying the disease. Spillovers affect humans, apes, and other animals. Human-to-human transmission is spread by contact with body fluids for infected hosts. Early reported cases show that hunters came in contact with animals infected with the Ebola virus, spreading the disease to the human population. Several outbreaks have continued to affect the DRC, and controlling them has been a large struggle for the whole organization and local governments in Africa.
For the top-down approach, local government can publish policy to limit the cross-border trade, implement travel measures, and create regulation on the contact of people with wild animals in this area. Also, it can set findings for related activities such as establish a research program. For the international response such as the World Health Organization, it can warn on the outbreaks, issue an alarm if necessary, and continuously monitors changes to the situation. Also, it can mobilize its collaborating laboratory and deploy a medical team of doctors with expertise in infection prevention and control and intensive care to support local conditions.
In the bottom-up approach, the general public needs to devise a system in order to avoid having transmission of the Ebola virus. Their plan should implement education, safe practices / prevention, and persuading / influencing the government to take action. The first initiative is to educate the general public about the Ebola virus and how it can get transmitted. At the same time, we should debunk false rumors pertaining to the virus. For the purposes of safe practice, individuals can eliminate direct contact exposure by wearing protective clothes, N95 respiratory masks, avoid being in areas where there is dense crowd of people. The general public should take a stand and have a rally so that the government should implement more funding on supplies and to have more protective suit gear and sanitary equipment for the community.
While considering the top-down approach or the bottom-up approach, there are certain roadblocks that will still be faced while implementing a plan with Ebola. With the top-down approach, it is important to write policies and allocate budgets that are culturally sensitive and take account of traditions in order to be fair to all those who are affected and ensure that the plans are effective. While with the bottom-up approach, making sure that the supporting materials used by local leaders to educate the community use simply, easily understood phrases, heavy on pictures to graphically represent the actions needed, and clearly state facts in order to create a holistic education curriculum.
Communication and outreach plan to decrease the spread of the Ebola virus. Number 1, for the community, we should educate the locals on how to avoid contact if you know someone who is infected. Number 2 is to teach them how to always wash their hands. Number 3 is immediately report to the nearest clinic if you know someone who is suffering from the virus. Number 3 is further increase the public awareness by posting signs and posters, as well as preventive measures with clear and concise instructions.
In addition to educating the public on important medical and safety protocols, a large part of outreach requires collaboration with both local and international organizations to be able to fund and support continuous and ongoing care to victims as well as their respective communities. Both social media campaigns and celebrity activism can and have drummed up significant support for Ebola as well as kept the issues in the public eye. Although organizations like MSF and WHO and their accompanying medical experts have been integral in controlling the spread of disease and mitigating risk factors, fundamental to this approach is co-opting local community leaders to communicate these ideas and disseminate information to help stop the spread of disease. Perhaps one of the most important challenges is quelling the local distrust of the medical system and any doubts about the governing body with regards to fighting Ebola.
Ebola no makongolele. Ebola no makongolele bananya. Unokowangi. Ebola sala kowang. Obanda ni ndena makongo kawale sala kowande. Memi mi wana jona jobu abaliga. Panumbadi mioma Ebola no makongo.